And this is case number 163. We have to bear in mind we need to maintain anonymity for this, so I'm not going to mention any names. It's the 71-year-old lady who was diagnosed with psychosis 30 years ago. This will be the third session we've gone in to look at her, and I've got specific questions here that I need to ask. So can you connect with her, Andrew, and just make a connection and tell me if you can pick up on how she's feeling at the moment.
Okay. Okay, so I've got a connection to her. So as I connect to her, basically my head feels like it's turned the other way around, so it's almost like I'm looking behind me rather than in front of me. So it's like there's something not, in my opinion, she's not located properly in her spiritual body, so her etheric must be out of line with the physical.
So the spirit is out of alignment.
Yeah, the head's facing backwards, basically. So it's like she's left her physical body at some point and then come back into it, but she's come back in the wrong way around.
Well, that's interesting.
Yeah, I haven't ever seen it before, actually.
Well, we're discovering new stuff all the time, aren't we? That's obviously interesting about this work. So we need to learn how to deal with this now. Can we have some advice from Chen on how this is dealt with?
Yeah, okay, so Chen's saying, basically, in his opinion, this is down to medication. So the medication that she's been on has basically detached her spiritual body from her physical body, and it's moved away slightly, and it's basically turned around. It's a bit like when you have a dream and you feel like you've left your body and then you come back in. If you don't come back in properly, you can't move your hands and your legs.
Right, now
like sleep paralysis type thing.
I've got personal experience with this. A lot of people experience this, and I've experienced it when I was being taught hypnosis. You can go into an altered state of consciousness and find it difficult to come back, and you feel that you're slightly out of sync, and you can't function properly. I know what it feels like, and I would challenge Chen's assumption. This is to do with medication, because as far as I understand, this lady has refused medication for a long time. So, and I do know from my own experience that this can happen without the influence of medication. So a shock can cause this. And I'm going to make a suggestion here. Perhaps Chen or this lady's higher self can support me on this. Just recently, the daughter mentioned that her mother had difficulty dealing with the situation regarding her brother, who is in a nursing home. Could some kind of emotional shock cause this
Chen, yeah, so Chen's saying basically, obviously when you dream, you can detach from your physical, and then if you don't come back in properly, you'd end up in this state. Right. But he's suggesting that this has happened through medication. It's basically changed the frequency of vibration of her etheric from her physical, and the two have become disjointed.
Right, well, if it was due to medication, it would have happened an awful long time ago. Because my understanding is that when she was first went into hospital, when she was first diagnosed, she was forcefully given medication. She said it was the worst time of her life, and she's not had medication since. So perhaps, does it go back that far, Chen?
Yeah, Chen's saying it, in his opinion, it's definitely a medication. The source of the problem was definitely medication. So yeah, it would have been some time ago, possibly.
Okay, right. So to get her resynchronized between the physical and the spiritual will be quite a profound experience for her if she's been experiencing this for such a long time.
Yeah, so Jen's just saying that with his team, they're going to basically disconnect her etheric, pull her out of her physical, and then turn her around and put her back in properly. He's saying so. He said if you because he's laughing. Actually, he's saying, "Can you imagine spending time being the wrong way round? Everything, all of your senses would be out completely."
Well,
So,
that's what's making me chuckle, you know.
yeah.
And then to be brought back in the right way round, and suddenly, you know, you can function properly again. Must be quite a profound experience. So,
Well, it'll be interesting to see what the feedback is when this has happened,
yes, it will.
because
Okay.
this is quite an interesting situation.
It certainly is. Okay, now I've got 3 questions here from the client that I'd like to address. So perhaps you can detach yourself slightly now, Andrew. Take a step back and have a look from an outside perspective. And perhaps we need to address... The first question is this. Why is she behaving so strangely as if she was under drugs? And why is she talking with different voices and accents? Now, apparently, when her daughter speaks with her on the telephone, sometimes she can sound like a mechanical robot. And sometimes she can speak with a different dialect or a different accent, as if she's from another language, another country. So this needs explanation.
Okay, so Jen's basically saying that this is part of her personality that's fractured over the years.
Okay.
Because I can't remember what we cleared now. We obviously cleared earthbounds, I guess. Just did a sovereignty check on her, and she's sovereign. And there's no earthbounds connected now, so it's not another spiritual energy taking over and doing that. So Jen's saying this is coming from a core personality.
So this is fragmented personality.
Yes.
You just used that term.
That's what he said to me, yeah.
Okay. Right. And of course, in my clinical work, I've come across this several times, and it's actually something that is not a surprise when someone who's been ill for this long. This is what happens. The cohesiveness of the self fragments. It's a bit like having an analogy I like to use is if the personality is like a huge drop of water, right, and then you drop a drop of water onto a hard surface, what happens to it? It splatters, doesn't it, into several fragments. And that's my analogy of the fragmented self. So what we need to be able to do is to bring all these fragments back together into a cohesive whole. This is a similar process to reintegrating dissociated subpersonalities, but on a much finer level. Does that make sense?
It does. I don't think we've done it before, have we?
No, we haven't.
No.
And that, again, that's why this case is interesting, because we're ploughing a new furrow here. So what does Chen make of the analogy that I just made?
Chen said it's very good from a kind of pictorial perspective.
Yeah, yeah.
So the way that he shows it to me, he just shows a picture of a person's mind, and then basically it splits into 4 or 5 different pieces, okay, and they kind of come out and go back in again.
Right. So I've used this analogy before as well. We've got to put Humpty Dumpty back together again. Yeah? So my question to Chen is this: is it possible? Because this is a problem that psychologists and psychiatrists have grappled with for centuries. How do you repair the fragmented self?
Yeah, it can be quite challenging to do that. And obviously, it's easier when you're doing a one-to-one with a client as opposed to working on them remotely without their input effectively.
Well, I'm not sure. I'm not so sure about that, because you've got resistance to overcome when you're working face to face. We don't have that resistance here. We're going straight in to the subliminal mind, beyond conscious awareness. We're going into the root, if you like. And I tend to find that easier than dealing with a conscious self. What does Chen say about that?
Yeah, he's just laughing now, saying, of course, he doesn't have that problem.
No.
Obviously, doesn't have to deal with the doesn't have to deal with the real person, effectively.
Okay, so
The real, well, not the real person, the real
the conscious self.
conscious self. Yeah.
Okay, so I'm trying to bring this into your domain, Chen, out of the psychological into the spiritual. And do you think we can make this work?
He said it's certainly worth trying.
Good. Okay, good. I'm very pleased about that. So we need to find a way. And can we use visualization? I like to see. We can use several models for this. We can use the model of Humpty Dumpty falling off the wall and a broken eggshell, and bring all the scattered remains back together and visualize them all reforming. It's like a video running backwards with something shattered to unshatter it, right? That's one way of looking at it. And the other way of looking at it is with the scattered drop that splashed. Again, run it backwards and bring all those fragmented parts back into a cohesive whole. So that's what I'm trying to do here. What do you reckon, Chen? You got any other suggestions?
No, Chen's saying that's certainly that visualization would work as far as he's concerned. So he's saying what he'll do is part of his team are going to go off and try to start to basically piece this person's fragmented personality back together.
Good. Let me move on to the second point that the client has made here, and she says her mother believes that there is a shape-shifting alien connected to her that's planted a machine in her abdomen. It's probably where the idea of the mechanical robot comes from. Is there any such device, Chen, planted within her?
Chen's saying there certainly were negative entity attachment problems before, which have been cleared now. So he's saying, as far as we're concerned, there isn't that problem now. So no, that doesn't exist today. Okay. But she may have perceived that before, which would have probably been correct.
This is what she's reported this since our